So in this diagram, what it's representing is a locked state that gets formed after we have something negative occurring in our lives. That negative can occur currently in your life. It could be last year. It could be 5, 10, 15, 20, 30 years ago. It can come from childhood. It can come from genetics. Whatever the negative experience was, when it starts to invade into our nervous system, into our immune system, into our hormonal system, and even into the circulation, it can cause problems all throughout the body. How do we return back to the state we were? This is a unhealthy and what we call a distorted state. The function is wrong. This is a healthy state, and that's where we want to go. If whichever level is in the wrong state, we must convert it over. That's how you get better. This represents the remedy, often a homeopathic remedy, that we're going to use to tell the system this is what's wrong with you, and then return back to here. So in this schematic, there can be different parts of the body, like the mind, losing your memory, emotions, the nervous system, immune system, hormones, circulation, the heart, the liver, the lungs, the eyes, the stomach. If you have stomach problems, we're going to say when it's contracted in this state, you have stomach pain. When it's back to the green state, stomach pain is gone. That's locked up in the memory of the nervous system and the immune system. Allergies, a very common problem that people suffer from. When the allergies are giving you trouble, we're going to say something is overreacting in the immune system. And that overreaction occurs over years of never having a tune-up. You would never let your car keep running forever without a tune-up. Why do we let our bodies run forever without a tune-up? So a tune-up is something that sharpens the nervous system and the immune system. And the only way to get in there is with a smart medicine. We call them remedies. We use neurochemical supplements, and these things, just like I said, are safer than vitamins, but they're high-tech in their ability to get into the part of the nervous system that needs treatment. If you have chronic musculoskeletal problems like chronic back pain or chronic headaches or chronic neck pain, we know you are only going to return back to your healthy state if you go from this purple state here back to the green. The green represents healthy. The purple represents a traumatized state or an unhealthy state or a state that you responded to something and didn't come back to health afterwards. Mucous membranes would be things like chronically sick in your nose, your throat, your sinuses, chronic sinusitis, which is a common problem. The skin would be things like eczema, psoriasis, chronic itching, or chronic sores on the skin that don't get better. And nails and hair. We all know that hormones are important for that, but also the immune system and the nervous system are important for that. So how do we get in here? In the next slide, we'll talk about how to get into the nervous system and make the change we're talking about. In this diagram, we're going to say that that purple on the previous part we talked about is the center of the brain. That's where all the important parts of the brain hold memory. When you have positive feelings deep inside the brain, and this is the subconscious or the unconscious, it also programs things like sleep, day-night cycle, which is the clock in the brain, temperature, circulation, thirst and fluid retention, appetite, fullness, and metabolism. This is where people really get hooked up with problems. If dial number 5 is blocked or not working well, it must be fixed in the center of the brain, not just from your stomach. Appetite and metabolism and sense of fullness is a critical part here. Hormones. We hear all the time now that hormones are very critical for long-term weight loss, for example, or long-term health for nails, hair, skin, and just feelings of energy. That's true. However, the part that programs the hormone is way up here in the center of the brain in dial number 6. This is called the hypothalamus and limbic system, and that's the part of the brain we must get to in order to make long-term permanent change. Energy. You remember when you were young and you had so much energy, you went out there, you couldn't wait to do life exactly as you were planning, and then something happened and you lost that energy. That's called the sympathetic nervous system. That's where drive comes in. The parasympathetic nervous system is your ability to relax, and that's also some people lose at a certain time in their life. You remember when you used to sit back and just relax on the weekends and go out to the park and have a good time? Well, some people have lost that ability to relax, and when you lose that, gaining it back is critical. Primal emotion would be waking up in the morning and feeling good for no reason, not just because you bought a new car or you're in a new relationship or your job's going well, but you feel well coming right out of the center of your brain right here. That positive signal makes you feel well emotionally, and this signal makes you feel well physically. Physical energy, that is the key in life. When we feel really good physically, we eat better, we exercise more, we have better relationships, we talk with a more positive tone in our voice. When we're feeling negative, just the opposite happens. We sabotage our relationships, we eat the wrong foods, we speak to people in a negative way, we react to our spouses or our children or our bosses or our co-workers in a negative way, and everybody knows that feeling inside of, I want to feel better, I want to react better, but something inside just doesn't feel better. How do we get to that? How do we treat that? That's what we're going to talk about next. In the disease state, disease, which really means dis-ease, meaning not feeling at ease anymore, you start to lose all those things we were talking about. You lose your ability to sleep, and doctors have sleeping pills ready for you. Even natural doctors have sleeping remedies for you, but to correct it is to get into this part of the brain and open up what's called the filter system. The filter system is what gets locked up after we've had something very difficult happen. It's a protective system. It sets up somewhere between the age of 8 and 12, and once this filter system sets up, if it does not thin down after 8 p.m. After 8 p.m. in the evening, the filter system opens up, and whatever we experience negative in the day is supposed to come out during sleep so that we heal during our sleep and feel really well the next morning. When that doesn't happen because things are locked up, that's when you need a clinic like ours. What we do is we go inside the brain and say, you may think what's bothering you is because you're eating too much sugar, and that's true. You may think that what's bothering you is you're not exercising enough, and that's true. You're not sleeping well enough, or you're not having enough good feelings in your job. That's all true, but that is all out here. This is where sugar lies. The temptation of eating sugar is a very addictive thing. When you give into that addiction, the more you give into it, the more it has control over you. How do you stop it? We have clinics where we use California Medical Weight Management, a highly structured system that will help you get off the addiction of sugar. Sugar is no different than cocaine, heroin, or anything else, is how addicting it is. How do I stop eating this chocolate, which is sugar? How do I stop even some vegetables like carrots, peas, and corn are high in sugar. Of course, breads, pasta, rice, potatoes, those are sugar in disguise. And the one I call donuts in disguise, which is bagels, those are what people get addicted to eating every morning for breakfast. Why? Because they go to the center of the brain and they make us feel good temporarily. For 1 to 2 hours, you feel better. And for the next 4 or 5 hours, you feel miserable. But the part of the brain here that thinks we need that sugar is 10 to 100 times more powerful than the rational brain. The rational brain says, don't eat that. And some people in category 1, maybe they got a little too much sugar in their diet, they get rid of it, they feel better, and they stay with it. Maybe they have a personal trainer, a dietitian, or even a caring doctor who says, look, we want you to stop eating so many of the wrong foods, and you get on the right track. The study showed 1 year later, 95% of whatever you did as a good change in your life starts to reverse. Why? Because this part of the brain is a sabotaging part of the brain. It holds some negative memory. Until that memory is extracted out from the brain, you're always going to be wrestling with yourself and struggling, what's called the yo-yo diet. I lost 50 pounds and I gained 50 pounds, or worse, I gained 60 pounds. You lose fat, muscle, and some electrolytes, and you regain fat. And the muscle begins to get less and less and less. That's why people say, I eat so little as I get older, yet I gain weight so quickly. Restoring muscle, there's only one way to restore muscle, which is through building that muscle. but many of us don't want to get off the couch to do it. We've been working hard. The end of our day, we are not very happy with what's happening, so you reward yourself through high carbohydrate foods. Are carbohydrates all bad? No, they're not all bad, but they produce a comfort in the brain that's so tempting that we overdo it. So to go from the disease state to a healthy state is critical for you to maintain all the good changes that you did after you finished a program like ours. After you finish it, we must treat the inside of the brain.